Welcome back. August is Breastfeeding Awareness Month, and we are joined now by Angela Cuson of Essentia Health to answer some common questions about breastfeeding. Thank you for joining us.
Thank you for having me.
Absolutely. So for those who want to or are able to, what are some of the benefits of breastfeeding?
There's all sorts of benefits, both short-term and long-term, for both the mom and the baby, including upper respiratory infections for infants, all sorts of infections that moms passively give the antibodies for. There's also longer-term ones that are leukemia, childhood cancers, behavioral things with children, positive cognitive things with children, long-term things like heart disease prevention, diabetes, type 1, type 2, inflammatory bowel disorders, diseases, those sorts of things, that the longer that child gets breast milk feedings or breastfeeding, chest feeding, there's more protection for all of those things. And for mothers, it can help with female cancers, diabetes, heart disease for mothers as well, among other short-term things like postpartum hemorrhage and so on.
A lot of things that I think we often don't hear about, a lot of those benefits. Obviously, with the pandemic ongoing, breastfeeding and vaccines have been a hot topic. Can you talk a little bit about the antibodies that can be given through breastfeeding?
Sure. In pregnancy, we know that antibodies are passively given to fetuses. And then once the baby is born, then they're passively given to babies through breast milk. And so the antibodies for COVID, if the mother has had a COVID vaccine or if she's had a COVID illness herself, either way, the antibodies will help protect the child from getting sick or severely sick. It's unlikely that infants have not been very seriously ill, even some of the most fragile infants whose mothers have been positive with COVID. If they contract it, it's unlikely that they'll be severely ill from it.
And just really quickly, where can people go for resources if they'd like to look into this a little bit more?
They can call us at Essentia. We're there 7 days a week at the lactation clinic. If for some reason they forget that, they can always call the birthplace and they can track us down. But we take appointments 7 days a week. We go see patients at the bedside. We have anybody that wants to come in for an inside appointment with themselves and their baby can come see us. We take appointments 7 days a week.
Okay.
And we also have pasteurized human milk for infants whose mothers maybe don't quite have enough milk while they're in the hospital. We have lactation space for both visitors, employees, and so on.
Perfect. Well, thank you so much, Angela, for being here. And again, if you have more questions, you can visit Essentia Health's website.